My name is Michelle Hamilton, and I'm here with my colleague and good friend, Mara Pinot. We are two oncology dietitians here at the UT Southwestern Harold C. Simmons Comprehensive Cancer Center. This video was created to discuss some ways to manage treatment-related symptoms. These shorter videos, like this one here, will cover each individual symptom. For a full overview, please click on the longer video for staying nourished during treatment.
Great, thanks, Michelle. So now we'll discuss tips for reducing dehydration. So what are some signs of dehydration? Some signs of dehydration may be headaches, dry lips, dry mouth, low blood pressure, dizziness when you sit up, decreased urination, sleepiness, or just decreased energy in general. The best thing you can do, what I always recommend my patients to do, is to check their urine color. So every time you use the bathroom, I recommend that you look at the urine and evaluate it. Is it clear? Is it dark yellow? Is it brown? We want it to be either clear or light yellow. Any darker than that, we want our patients to keep on drinking. And when I say drinking, it can be any kind of decaffeinated fluid that works for you. So if you're not a big water drinker, you can drink juice, you can drink milk, whatever works best for you. In general, 64 ounces or about 2 quarts per day is the minimum of what we want our patients to drink. But again, please check your urine. So what are some products that can help with dehydration? So if you are dehydrated, whether it be from diarrhea or from nausea and vomiting, there are some products that can help replete those electrolytes and get those fluids into your cells a little faster. So some examples are Drip Drop, Pedialyte or even Pedialyte popsicles, G2, which is a Gatorade product, Liquid IV, and you can make your homemade drinks as well, which the recipes will be on the next slide. So these recipes are ones that you can make on your own. If you have these products in your pantry or at home somewhere, you can make these yourself, and they will be, equatable to the products that were on the previous slide. So let's say that you're unable to drink a lot of fluids, or you just need some extra fluids within your food. There are a lot of foods that have a high fluid content. These foods are things like fruits, like watermelon or berries, popsicles, soups, broths, ice cream, sherbet, even ice chips, and even the nutrition supplements that you drink. So let's say you have been recommended to drink Ensure. You might think of Ensure as a high calorie, high protein meal replacement. However, it does have fluid within that as well, so it can contribute to your fluid status. Here are some ideas to kind of keep you on track with your fluids. So one is, I always recommend my patients to set alarms. I always recommend setting alarms for every 2 to 3 hours to remind you to either eat or drink. You can also have products in your home, like the water bottle that lights up when you need to drink a little bit extra. You can get the water bottle that has the increments on there so that you can keep track yourself, or even have an app or a journal to keep track yourself as well. Here's some additional resources. These are resources that us dietitians use on an almost daily basis. At the bottom is the UT Southwestern Oncology Nutrition website. That's a great one to go to. A lot of information just based on what we provide and recommend within our patient populations. American Cancer Institute for Research is another great one. So reach out to either your dietitians on your team or to these resources for more research-based information. And thank you everyone for listening into this presentation. If you have any questions whatsoever, please reach out to your medical team. And if you don't know your dietitian, they can let you know who that dietitian is. And if you do know your dietitian, please reach out if you have additional questions. Thank you so much and have a great day.
Thank you.